and these symptoms largely depend on where exactly these tissues are deposited. And an interesting case I got to see was a lady that had endometrial tissue deposited in her pleural cavity, that's in her lungs. So every month when she menstruates, she also bleeds into her lungs, and she will come down with symptoms of difficulty to breathing. She will also have symptoms like chest pain and stuff like that. Hi everyone, welcome to my channel. I hope you're well. I hope you're doing great. It's Dr. Judith Ebengho here again. And before we get into today's episode, please, I need you to do me a favor. If you have not yet subscribed to this channel, what are you waiting for? Really, what are you waiting for? Please subscribe to this channel. I need it for my channel to grow. And also like my content, share my content with people, please, and leave me a comment. If there's anything you want me to talk about, any question you have, leave me a comment. Or if you're too shy to leave a comment, you can send an email, but please just leave me a comment. I'll prefer that. Anyways, in today's episode, we're going to be talking about endometriosis, and you guessed right, it's part of our series on infertility. So first, what is endometriosis? Endometriosis is when you have endometrial tissue outside of the uterus. So what is endometrial tissue? If you remember our topic on uterine fibroids, then I talked about the three different layers of the uterus. We have the perimetrium, we have the myometrium, and then we have the innermost layer, which is the endometrium. Endometrium is just that part of the uterus where menstruation comes from. So this is the part that is shed monthly as menses. So when you have tissues, this type of tissues outside of the uterus, then we're dealing with endometriosis. It's also worthy to note that the cause of endometriosis is largely unknown. So there are different theories that have been postulated by scientists, but largely nobody really knows why these endometrial tissues will leave where they are supposed to be and then get deposited in other parts of the body. It's worthy to note that about 7 to 10% of women will be affected by endometriosis, and out of this percentage, half of them would have no symptoms at all, while other 50% would have symptoms of endometriosis. And these symptoms largely depend on where exactly these tissues are deposited. And an interesting case I got to see was a lady that had endometrial tissue deposited in her pleural cavity, that's in her lungs. So every month when she menstruates, she also bleeds into her lungs, and she will come down with symptoms of difficulty to breathing. She will also have symptoms like chest pain and stuff like that. And all of this did not stop until she had a procedure that helped to close that cavity within the lungs where the endometrial tissue bleeds into. So like I mentioned, the symptoms of endometriosis is largely dependent on where these tissues are deposited. But most majorly, endometrial tissues are actually deposited within the pelvis. So what are some of the signs and symptoms of endometriosis? One particular symptom of endometriosis is the excruciating period pain that women experience. If you have excruciating pain when you menstruate, and this pain doesn't even respond to normal pain medications that are sold over the counter, then you definitely want to get evaluated by a specialist. Another symptom of endometriosis is pelvic pain, and some women go on to have chronic pelvic pain. There's just this ache around the pelvis because of all the deposits and all the different things that are going on within the pelvis. Women with endometriosis may also experience painful sexual intercourse, abnormal uterine bleeding, irregular periods, and things like that. Now down to the big one: how does endometriosis cause infertility? Endometriosis is when there are deposits outside of the uterine cavity. Remember that definition. So when these deposits are within the pelvis, there are a lot of reactions going on there. Before you know, it will form adhesions, because imagine you're just bleeding into the pelvic cavity. So all of this together would cause adhesions. You find the tubes being matted together. There's blockage of the tube. The egg cannot the sperm cannot locate the egg and stuff like that. So all of these things going on within the pelvic region would lead to serious adhesions in that region, and it would be very difficult for fertilization to occur. How do we make a diagnosis of endometriosis. There are a lot of things that goes into making a diagnosis. You want to take a good history, you want to examine the patient, you want to do some tests, and particularly the laparoscopy helps us to visualize the endometrial deposits within the pelvis, and then a diagnosis of endometriosis can be made. So you have like the chocolate colored cysts. You don't need to know this, but you have this chocolate deposits maybe on the ovaries, on the broad ligament, things like that. So just speak to a specialist. When they see all of these things on laparoscopy, then they are very sure, together with the symptoms that the patient may have, then they will be sure that, oh, this patient has endometriosis. Now, how do we manage endometriosis? There are two broad categories here. We have the medical management and the surgical management. For the medical management, you want to help this patient with pain medication, because the period pain can be excruciating. It is so bad. So pain medications are a very important part of managing endometriosis. Then there are some hormonal drugs that can be given to suppress ovulation, to delay periods, and things like that, that will just help alleviate the symptoms. Because with endometriosis, every month is a battle. Every time a woman sees her period, it is a battle. So there are different drugs that can be given to just help, things like combined oral contraceptive pills, gonadotropin receptors, antagonists, and stuff like that can just be given to help. But you don't just go and purchase these medications. You have to speak to a specialist that will determine which one particularly would work for you. Now, down to the surgical management. There are different methods out there. Maybe a laparoscopy can be done, a laparotomy, depending on what the specialist decides, and hysterectomy can even be done. For these patients, concerning fertility and in vitro fertilization can be explored to help with achieving conception and all of that. But all of this will be determined by a specialist. And then endometriosis really is not the end of the world. Thanks to technology, there are different options there that can be explored. Like I've previously talked about, like IVF can be explored, surrogacy, different things. So you definitely want to speak to a specialist, learn what your options are, and then make an informed decision. We've come to the end of this episode, guys. Do not forget to like, share, and subscribe. Please subscribe and turn on post notification. You want to know when I have new videos on this channel. Share this video with your sister, guys. Like, share it with a woman in your life. They need to know what's going on in their bodies and how to make informed decisions. Till I come your way next time, I remain Dr. Judith Ebengho. Enjoy yourself. Bye.